applicators in a plastic bag. Wipe the secretions from the lips and corners of the mouth. Apply lubricant to the lips. Remove your gloves. Clean and replace the equipment to the proper storage area. Dentures are removable artificial teeth. Some patients have upper and lower dentures, others have just upper or just lower, while others still have a partial plate. Patients may feel embarrassed about wearing dentures and may dislike being seen without them. In the past, I've worked on a surgical unit where dentures were required to be removed for surgery. Many patients would tell me, "Oh, I don't want them removed now," but would wait until they got down to the surgical suite. They would be removed then and then placed back in their mouth after the surgical procedure before coming back up to my unit. Frequently, the patient said, "My family has never seen me without my dentures, not even my spouse." Provide privacy when dentures are removed and cleaned. Remove the lower denture first by grasping it firmly, easing it upward, forward, and out of the mouth, followed by grasping the upper denture, easing it downward, forward, and out of the mouth. Be sure to handle dentures carefully. Transport them in a cup or amethyst basin that has been lined with a washcloth or paper towel. If dentures are broken, patients are having to have very soft food or pureed foods until those dentures can be fixed, not to mention the cost involved. So be very, very careful when handling them. Hold the dentures over a sink in a cup or amethyst basin that has been filled with cool water. Use a denture brush if it's available, as it's designed specifically for cleaning dentures. Clean and check the patient's mouth for any signs of gum irritation that might have occurred from the dentures. Store the dentures in a safe place when out of the resident's mouth, for example, in a bedside drawer, in a denture cup, labeled with the patient's name. Now please watch a demonstration of denture care. Apply a towel under the chin. Apply the gloves. Allow the patient to remove and clean the dentures if able. Assist if necessary. Place the dentures in a cup or amethyst basin for transport to the sink. Assist the patient to rinse their mouth with water or mouthwash. Hold the amethyst basin under the chin for removal of the mouthwash. Wet a toothette or applicator with mouthwash or water and assist to clean the gums and tongue. Inspect for condition of teeth, mouth, tongue, and lips. At the sink, hold the dentures over the cup or amethyst basin of cool water to act as a buffer if the teeth are dropped. Keep the dentures out of the sink, as it is considered a dirty area. Apply toothpaste and brush all surfaces with the denture brush. Rinse the dentures thoroughly under cool water. Place the dentures in a denture cup of fresh, cool water. Place in a safe storage area or assist to replace in the mouth. Remove your gloves and wash your hands. Clean and replace the supplies to the storage area. Nail care is usually done during bath time. It's frequently one of the first activities of daily living that the resident can no longer do for themselves because it requires dexterity, flexibility, and good vision. Routine nail care can help prevent infection. This is particularly important for patients that have diabetes and those that have poor circulation. Fingernails and toenails must be kept short, clean, and free of any rough edges. With inactivity and the elderly, nails may become brittle, thick, and difficult to trim. It's easier if the nails are trimmed after soaking in warm water. Trimming the nails weekly makes the job easier as well. If the nails are long, they're much more likely to split when they're being trimmed. There's a variety of tools that are used for caring for nails. Emery board or nail file for smoothing the rough edges. An orange stick, when available, works well for cleaning under nails, as does a nail brush. Clippers should be used for cutting rather than scissors. Never use a scissors for cutting, as you might accidentally cut them. Nails are to be cut straight across, not curved on the edges. Observe carefully during nail care for any broken nails, hangnails, corns, calluses, open or irritated areas, and be sure to report any of those abnormalities to your supervising nurse. There are certain residents that will have their nails, especially the toenails, trimmed by either a licensed nurse or a podiatrist. A podiatrist, another name is a foot doctor. These are residents who have diabetes, poor circulation, are on certain medication, or have some other health condition. Be sure that you check the policy and procedure at the facility you work in to determine the policy for nail clipping there. Also, read the foot care for the diabetic in your student manual that follows in this unit. Now watch a demonstration of cleaning and trimming the nails. Assemble the equipment. Apply your gloves and protect the workspace with a bath towel or water-absorbent towel. Soak the resident's hands or feet about 20 minutes in warm water, 105 degrees, to soften the nails. Wash the resident's hands or feet with warm, soapy water. Clean under the nails with an orange stick or tip of the file. Be gentle so as not to injure soft tissue. Wipe the orange stick on the towel after each nail. Push the cuticle back with the orange stick or washcloth. Clip the nails straight across above the tips of the skin. Dry hands or feet. File the rough edges using an emery board or nail file. Apply lotion and gently massage. Remove your gloves. Clean and replace your supplies to the storage area. Wash your hands. The perineum is the area between the individual's legs. Perineal care may be performed as part of the bath, or it can be as a separate procedure. For example, if a resident has been incontinent of urine or has had diarrhea, then perineal care would be needing to be done then as well. Perineal care, oftentimes shortened to be just called pericare, means to bathe the area inside or including the genitals, and in the female, that's the pubic and vaginal area, and in the male, the penis and scrotum. And in addition to the genital area, it includes the washing of the rectum and anus area. Pericare is all